Hello, welcome everyone. This is my just a quick intro to the your video education series on menopause and perimenopause. I like to call it Menopause Explained, and you will be starting 5 modules, and it all builds on each other. We're kind of at the beginning. We'll be laying the groundwork for understanding uh, actual treatments and actual risks and actual benefits. So sometimes it may feel like there's too much information at the beginning, but the point here is for you to get all the information, because you can't get it from a 1 hour webinar that some local provider is offering you, and you can't get it from a 15-minute appointment with your medical provider, be it a doctor, nurse practitioner, or um, physician's assistant. So it really takes a lot of education. And so you are going to get it with this video series. And this will help you to empower you to decide what you want to do about the symptoms you're having, decide if they are perimenopause or menopause, what you need to rule out, and then decide if you want to do any sorts of treatments. And there's a lot of different treatments. It's not just hormone therapy. So I want to make sure you are informed. And that's the reason I decided to do this video education series, because so many patients are not getting the information they need. Not only do I take care of patients who are in menopause, I've been doing that for 25 years. I'll tell you a little bit more about my background in a second. But I am also seeing all of these complaints on these Facebook groups, and I'm thinking to myself, wow, we just need this out there, and that someone can access the education that they need. This video series will probably need to be updated every year because new studies are coming out and new recommendations are coming out. But it is current for right now let's say I'm recording it at the end of 2025. So it's current for 2026 and hopefully for beyond. I want to give you a little bit about my background. I'm Dr. Orly Steinberg. I'm a board certified OBGYN. I finished my residency program, so meaning the training program to be an OBGYN in the year 2000. So it's been quite a while that I've been practicing. And my first practice out of residency, I joined a practice as an OB/GYN. So I was still doing OB at that time, but I joined a practice where two of the doctors were not doing OB. They were doing just gynecology, and they were starting to even do research studies for menopause. They were treating a lot of menopausal symptoms, patients at the time. And I was so lucky to be in the same office as those two physicians, because then I got to learn from them how they were managing their patients, what should I do with a patient. I could talk to them at any time. So it was very, very useful and helpful to me. And it inspired me to stay up to date on menopause treatment, perimenopause treatment. There's a lot of doctors who are OBGYNs are so busy with their obstetric practice, or they're busy doing surgery that they are not staying up necessarily on perimenopause, menopause treatment, the latest information, the latest treatments, the latest prescriptions. So this is important. So it was important to me. I had gone to undergraduate at the University of Pennsylvania in Philadelphia. That was kind of far from home because I grew up in Houston, Texas. And from undergraduate, I came back to Houston, Texas for medical school at Baylor College of Medicine. From there, I went to a residency program at George Washington University in Washington, D.C., and finished that 4-year residency in 2000. I moved out to Seattle after my residency program because I had visited there during my residency and fell in love with the beauty of the Northwest. Lots of beautiful places in this country. But I've been here ever since, for the most part. I had a 2-year hiatus where I was in North Carolina, which was a lot of fun. So I wanted to go back to why I decided to make this series. I decided a few years ago to stop practicing obstetrics and just do gynecology and just do office gynecology. And when I started doing that, I realized I was getting a lot of patients kind of coming in to see me with menopausal symptoms. Maybe I had more time in my schedule because I wasn't seeing as many obstetric patients. And as I continued to do that, I decided to focus my practice on menopause and still do some other gynecology, but with a primary focus on menopause or perimenopause. So I went ahead and said, well, I should be a menopause certified provider with the Menopause Society. And I went ahead and took that test and became a certified provider. The American College of OBGYN, which is how I'm board certified, doesn't have any sort of certification for menopause treatment. So that's the only option that's out there at this time. There's plenty of doctors who are not certified, who are knowledgeable, but I wanted to go ahead and do that. And my practice is focused on menopause now. I'm not doing this series to get more patients. I limit my practice. I don't want to be one of those crazy busy doctors who doesn't know her patients, but I wanted the information out there. I see the need for it in the Facebook posts, so much on social media, on Instagram. I see that there's a need for this education out there and something that's more relatable. So I'm doing this video series the same way I talk to my patients one-on-one. I try to explain it in ways that everyone can understand. And I'm not perfect. I'm not trying to be perfect, but I'm trying to make it so that you, the patient, will understand and have a little bit more in-depth understanding of the reasons you're having symptoms. Is it really perimenopause or menopause? What are the risks? What are the benefits? What are the possible treatments, etc.? So let's get going. I'm going to stop talking here and let you get going with module 1. And welcome. I'm excited to hear comments back from you guys on this course. Let me know what I could do better and also what I could add to the course. All right, have fun and let's get informed and educated. And remember, you are an individual. I want to make sure you remember that. You're an individual, nothing is cookie cutter. And so just keep that in mind as you're learning all about this. Okay. All right, let's have fun and let's learn. Learning is fun.